Top 6 Best Vitamins to Strengthen Your Legs. Imagine you step out of bed every morning with a healthy body and legs. You can walk around the park and exercise without worrying about muscle weakness and cramps. You are free to move around and go to places you like with your feet. And the secret to healthy legs in old age lies in nutrition. In this video, we will reveal the 6 best vitamins and minerals to keep your legs healthy. Before we begin, please encourage us by watching the video and leaving comments and questions below. Don't forget to like and hit the subscribe button so you don't miss any good health tips from us. First, talk about vitamin D. Older people often lose vitamin D due to reduced absorption with age and lifestyle. Now, look closer at why vitamin D is an essential nutrient for older people. Vitamin D is a nutrient that helps the body absorb calcium and phosphorus from food, 2 minerals needed to build and maintain strong bones. In older people, the ability to synthesize vitamin D from sunlight decreases due to aging skin and less exposure to sunlight than younger people, along with a decline in absorption. Studies show that older people often lack vitamin D, leading to the risk of osteoporosis and other bone problems such as arthritis or even depression due to limited mobility. When bones weaken, the ability to move and walk in older people is challenging, making them susceptible to falls and fractures. Supplementing vitamin D helps calcium absorb into the bones better, avoiding osteoporosis, thereby making bones harder and stronger. According to many studies, vitamin D not only affects bones, but also has an essential effect on muscle recovery, helping to improve neuromuscular function. Vitamin D can increase coordination between muscles and nerves, helping older people maintain better balance. Vitamin D deficiency makes older people tired and reduces their ability to move and perform daily activities such as walking, climbing stairs, or standing up from a chair. Supplementing enough vitamin D will help muscles recover faster while maintaining the body's flexibility and suppleness. To prevent vitamin D deficiency, older people need to pay attention to supplementing vitamin D through their diet, which is also the safest way to supplement. Some foods rich in vitamin D include salmon, tuna, sardines, egg yolks, milk and dairy products, mushrooms, and supplements. In addition, exposure to sunlight for a short time of about 10 to 30 minutes a day also helps the body synthesize vitamin D. If vitamin D supplementation through food is not enough, you must supplement vitamin D through tablets. Supplementing vitamin D through tablets for older people is very important because an overdose of vitamin D can be harmful to health, such as hypercalcemia, kidney damage, and cardiovascular problems. The amount of vitamin D to supplement, according to the recommendations of the World Health Organization, WHO, is from 800 to 1,000 IU per day for those at risk of osteoporosis or bone problems, less exposure to sunlight. People living in cold climates may need to supplement more from 1,000 to 2,000 IU per day. Before supplementing vitamin D, consult your doctor to determine the appropriate dosage for your body. 2. Calcium. Calcium is an essential mineral for the human body, playing an important role in maintaining healthy bones, muscles, and the nervous system. Calcium loss in the elderly is a common problem. There are many reasons why the elderly are deficient in calcium, such as reduced absorption due to age, lack of vitamin D, and loss of calcium through urine due to certain corticosteroids or blood pressure medications. For older people, calcium is essential in maintaining flexibility, muscle strength, and mobility. So, why is calcium necessary for older people, and how much calcium is needed each day? We will learn about calcium together. Calcium is a mineral that makes up a large part of the bone structure and is essential in maintaining strong bones. As we age, the bone regeneration process slows down, causing bones to become thinner and weaker, more susceptible to fracture and damage. Calcium not only helps keep bones healthy, but also directly affects the mobility of older people. When bones are strong, older people can move more efficiently, reduce the risk of fractures due to falls, and maintain the flexibility needed to perform daily activities. Calcium deficiency can lead to many other serious problems for older people. Osteoporosis is one of the common problems, causing bones to become brittle and break easily. People with osteoporosis are often at higher risk of fractures, especially the hip and spine. In addition to bones, calcium is also essential for muscles. the body needs calcium for muscles to contract and relax properly. Calcium deficiency can lead to muscle weakness, cramps, and muscle pain, making it difficult to move freely in activities such as walking, climbing stairs, or standing up from a chair. Older people should pay attention to calcium-rich foods, such as milk, salmon, and chia seeds, to supplement calcium. However, eating calcium-rich foods alone is sometimes not enough because older people often have difficulty absorbing calcium from food, especially as they age. Therefore, calcium can be supplemented through tablets. According to recommendations from the U.S. National Institutes of Health (NIH), the daily calcium requirement for older people is 1,200 milligrams of calcium per day. However, because each person has a different calcium deficiency, you should consult your doctor to supplement the appropriate dose, avoiding excess calcium causing kidney stones and cardiovascular problems such as arrhythmia and high blood pressure before supplementing. 3. Vitamin B6. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that is very important for the body, participating in many physiological functions such as protein metabolism, supporting the nervous system, and maintaining the health of red blood cells. As we age, the elderly may experience vitamin B6 deficiency due to decreased liver function, which reduces the body's ability to metabolize vitamin B6, diet, and chronic kidney and cardiovascular diseases. For older people, vitamin B6 plays a vital role in maintaining muscle flexibility, enhancing nerve function, and reducing the risk of mobility problems, including walking. One of the most important roles of vitamin B6 is to support the nervous system. Vitamin B6 synthesizes neurotransmitters, including serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, improving nerve function. For older adults, maintaining a healthy nervous system is essential to ensure the ability to move around and perform daily activities. When vitamin B6 is deficient, older adults may experience neurological problems such as numbness, tingling in the hands and feet, or loss of sensation, which can reduce muscle control and lead to difficulty walking. Vitamin B6 helps maintain muscle coordination and reflexes, reducing the risk of falls and improving mobility. Vitamin B6 also plays a vital role in maintaining muscle health. It helps the body metabolize protein, an essential component of muscle. When older adults are deficient in vitamin B6, their ability to synthesize protein and build muscle decreases, leading to muscle weakness, cramps, or pain, and make it difficult for older adults to walk or perform light daily tasks. Vitamin B6 supplementation will increase muscle strength and maintain flexibility, helping older adults move more quickly. A strong muscular system is essential for maintaining mobility and reducing the risk of injuries from falls. Cardiovascular health is also a factor that affects the mobility of older adults. Vitamin B6 helps regulate homocysteine levels, an amino acid linked to the risk of heart disease. When homocysteine levels are too high, it can lead to cardiovascular problems, reduce blood circulation, and affect the health of muscles and bones. Vitamin B6 supplementation can help maintain cardiovascular health and improve blood circulation, thereby supporting the mobility of older people. Vitamin B6 plays a vital role in maintaining the health of the nervous system, muscles, and cardiovascular system of older people. By supplementing enough vitamin B6 daily, older people can improve mobility, reduce the risk of falls, and maintain flexibility in daily activities. According to recommendations from the U.S. National Institutes of Health (NIH), the amount of vitamin B6 needed for older people is 1.7 milligrams daily. Older people can supplement foods rich in vitamin B6, such as poultry, fish, potatoes, bananas, cereals, seeds, beans, and green leafy vegetables. In addition, vitamin B6 is also supplemented through tablets. Supplementation through tablets must be done in the correct dosage because excess vitamin B6 can cause side effects such as peripheral nerve damage and fatigue. 4. Potassium. Potassium is an essential mineral that helps maintain fluid balance, regulate blood pressure, and support muscle and nerve function. Potassium is critical for maintaining bone health, muscle strength, and mobility. Potassium deficiency can lead to serious problems, including muscle weakness, fatigue, muscle cramps, and difficulty walking. Potassium plays a vital role in maintaining muscle and nerve function. Particularly for older people, potassium helps the body maintain muscle flexibility and strength, supporting mobility and walking. When potassium levels decrease, muscles can become weak, leading to muscle cramps and fatigue, reducing mobility. Potassium also helps regulate muscle contraction and maintains nerve cell activity. Without potassium, nerve signals cannot be adequately transmitted, causing decreased coordination and balance and an increased risk of falls. Another critical factor is that potassium helps regulate blood pressure. Most older people suffer from high blood pressure, so maintaining stable blood pressure is very important to prevent cardiovascular problems. Potassium helps reduce the effects of sodium in the body, thereby supporting the lowering of blood pressure and reducing the risk of high blood pressure, a common problem in the elderly. Older people can add potassium-rich foods to their daily diet or supplement potassium through pills to provide enough potassium for the body. Here are some foods that are high in potassium. Potatoes. Potatoes are a tuber that contains a lot of potassium, especially when eaten with the skin. A large potato can provide up to 900 milligrams of potassium. Beans. Like black beans and lentils, green beans are excellent sources of potassium. A cup of cooked lentils can provide 700 milligrams of potassium. Bananas. This is also a popular fruit rich in potassium. An average banana can provide about 400 to 450 milligrams of potassium. Providing enough potassium for the body can help older people maintain bone, muscle, and cardiovascular health. However, too much potassium can also cause kidney or heart problems, so potassium supplementation is needed appropriately. According to the U.S. National Institutes of Health, NIH recommendations, older adults aged 51 and older must supplement about 3,400 milligrams per day for men and 2,600 milligrams per day for women. 5. Vitamin B12. Vitamin B12, also known as cobalamin, is an essential water-soluble vitamin that plays a vital role in maintaining the health of blood cells, the nervous system, and energy metabolism. Especially for older people, vitamin B12 profoundly affects the body's health, especially in maintaining flexibility and mobility. A lack of vitamin B12 can lead to severe problems, including fatigue, muscle weakness, and difficulty walking. One of the critical roles of vitamin B12 is maintaining the nervous system's health. Vitamin B12 helps the body synthesize myelin, a protective sheath for nerves, helping to transmit signals quickly and effectively. When vitamin B12 is deficient, myelin is not produced sufficiently, leading to nerve damage and reducing the ability to move and control muscles. A vitamin B12 deficiency in older adults can cause symptoms such as numbness, tingling in the hands and feet, loss of sensation, or reduced muscle coordination. This makes it challenging to move around and can even increase the risk of falls. Furthermore, a vitamin B12 deficiency can also lead to memory problems, loss of balance, and decreased concentration, all of which affect the ability of older adults to walk. Vitamin B12 is essential for the nervous system and is vital in maintaining muscle health. A vitamin B12 deficiency can lead to muscle weakness, fatigue, and muscle cramps, making older adults feel tired when moving or performing physical activities. Vitamin B12 deficiency can make it difficult for older adults to maintain flexibility and muscle strength, affecting the ability to walk and increasing the risk of muscle and bone-related diseases. Adequate vitamin B12 supplementation will help increase muscle strength and flexibility in daily activities. To maintain adequate vitamin B12 levels, older people need to pay attention to supplementing foods rich in vitamin B12 in their diet. Below are some foods that provide a lot of vitamins B12 but are safe. Fish and seafood. Fish such as salmon, tuna, sardines, and shrimp are rich in vitamin B12. A 100-gram serving of salmon provides about 4 micrograms of vitamin B12. Animal meat. Meats, including beef, lamb, and chicken, are rich sources of vitamin B12. A 100-gram serving of beef can provide 1.5 to 2 micrograms of vitamin B12. Eggs. Eggs are also an excellent source of vitamin B12, with one egg containing about 0.6 micrograms of vitamin B12. The amount of vitamin B12 needed by seniors can vary depending on the individual. But according to recommendations from the U.S. National Institutes of Health, NIH, seniors aged 51 and older should supplement about 2.4 micrograms of vitamin B12 per day. For those at risk of vitamin B12 deficiency, such as vegetarians and people with stomach problems or absorption problems, vitamin B12 supplements may be recommended at a higher dose as a doctor prescribes, to avoid excess and unwanted side effects. 6. Magnesium. Magnesium is essential for the body's health, especially for older people. One of the reasons why magnesium deficiency is common in the elderly is due to the gradual decrease in the ability to absorb magnesium through the digestive tract. The use of many drugs, such as diuretics, blood pressure medications, and proton pump inhibitors, can reduce magnesium levels in the body. In addition, the elderly often suffer from chronic diseases such as diabetes. Kidney disease is also the cause of magnesium deficiency in the body. One of the main functions of magnesium in the body is to regulate muscle activity. Magnesium helps muscles contract gently, which is especially important for older people. With enough magnesium, the body can easily regulate nerve signals to the muscles, allowing the body to move flexibly and without experiencing muscle stiffness or pain. This means that older people can walk more easily, climb stairs, or perform daily activities without feeling tired or having difficulty. When magnesium is deficient, muscles become weak and are prone to stiffness or muscle tension. Older people may find it difficult to move and are prone to muscle cramps or pain, especially at night. This condition causes discomfort, reduces mobility, and disrupts sleep, making it difficult for older people to recover from physical activities. Magnesium is essential not only for muscles, but also helps regulate nerve signals, helping to calm overactive nerve signals and helping the body relax and maintain flexibility in movement, thereby preventing muscle stiffness and ensuring the body can relax properly. When magnesium levels in the body are low, the nervous system cannot transmit signals properly, which can cause loss of balance, difficulty controlling movements, and an increased risk of falling. This is especially dangerous for older adults because their mobility is easily affected by neurological problems. Magnesium also plays a vital role in bone health, which is indispensable in maintaining the mobility of older adults. Magnesium helps the body regulate calcium transport into the bones, reducing calcium deposition in soft tissues and thereby preventing stiffness and joint pain. When bones are healthy, older adults can maintain the flexibility and strength needed to move more quickly. Calcium is an essential mineral for bone health, but cannot function effectively without magnesium. Magnesium helps maintain bone density and reduces the risk of osteoporosis, a common problem in older people, causing bones to weaken and break easily. A daily diet is the best way to supplement magnesium for the body. Here are some magnesium-rich foods that older people can add to their diet. Green leafy vegetables, including vegetables such as kale and spinach. Nuts, including almonds, chia seeds, pumpkin seeds, sunflower seeds, bananas, and avocados. These are two fruits that are not only rich in potassium, but also very rich in magnesium fish, such as salmon, tuna, sardines. When the diet is not enough to meet the magnesium needs, older people can use magnesium supplements. Experts recommend 420 milligrams of magnesium daily for men and 320 milligrams for women. Here are 6 vitamins and minerals you must supplement daily for healthy feet. If you find this helpful video, please like and subscribe to the channel to support us. Let us know your thoughts by leaving a comment below. Goodbye, and see you in the following videos.